Well, as you've just heard last night, this programme revealed alarming figures of death rates in British hospitals compared to other developed countries. 45% more likely to die in hospital here than patients in America. For conditions affecting the elderly, the statistics are even more shocking, showing that you are 5 times more likely to die of pneumonia in an English ward compared to an American one. Well, our report last night sparked huge outrage on social media, with plenty of viewers accusing us of supporting the privatisation of England's healthcare system. Well, I'm joined now by Peter Walsh from Action Against Medical Accidents and Dr. Jackie Davis, a consultant radiologist and member of the National Health Action Party. Dr. Davis, can I begin with you? There was such an angry response to the figures last night, claiming that the figures weren't just, that the whole report, was wrong. Isn't this part of the problem that, we can't talk openly about problems and failings within the NHS?
I think people are really anxious to talk about problems and failings in the NHS with the aim of getting things right for patients. I think the problem with the report last night was that some figures were taken and extrapolated, conclusions were drawn, which most people really didn't think were fair.
Well, you say most people, but Sir Bruce Keogh, the head of NHS England, he supports the figures in terms of saying they may not provide the whole picture, but they are a vital signal. The government accept that. Patients' groups accept that.
Well, these figures, the hospital standard mortality ratios, have been called by a recent article in the British Medical Journal not fit for purpose. So there is no general agreement that they are the right thing to do. And at
so
best,
Sir Bruce Keogh is wrong, is he?
Well, Sir Bruce Keogh has said about them very recently that to draw firm conclusions from them is academically reckless. That was what Sir Bruce Keogh said.
He was interesting last night because he said while HSMRs might not be the whole picture, when they exposed problems at mid-staffs, people spent a lot of time talking about methodology while bad things were happening. We can't afford that to happen again, can we?
No, I think it's absolutely right that if people are concerned that there are problems, we need to look at them. But I think that to alarm patients and undermine staff by coming to the sorts of conclusions that the programme came to last night is probably not a very good idea. And I think that's why people are outraged. They were also very angry about the comparisons that were made with America, which were quite frankly comparing apples with oranges in a way that wasn't helpful.
It's all mortality rates, isn't it?
No, but there are all sorts of things that you can look at. The Mayo Clinic, for instance, has a budget of £8 billion a year, and you don't get through the door unless you've got a very good insurance policy.
Peter Walsh, sorry, let me bring you in here. What's your view on this?
Well, frankly, I think it's a sterile debate to concentrate on the methodology or the exact conclusions to be drawn from research like this. That's exactly the kind of distraction and denial that we saw in mid-Staffordshire when high mortality rates in that hospital were ignored, and ignored at an extremely dear cost of people's lives. One thing is absolutely undeniable, and that's that thousands of patients are dying quite unnecessarily in our hospitals every year. Now, mortality rates are not the only indicator of poor or unsafe care, but they are an important indicator, and I believe Sir Bruce Keogh has got it absolutely right to, for example, investigate the 14 trusts with consistently high mortality rates and look at what the problems are behind that. The mortality rate in itself doesn't give all the answers. The important thing is that there's an in-depth investigation that finds out whether care is unsafe.
Jackie Davis?
Yes, I absolutely agree. I think if there are if there's smoke going up, you have to make sure, is there a fire there? And I think what may come out is that there are reasons why some hospitals have more deaths in them than others. For instance, if they don't have a hospice nearby, it may be that that's where patients actually go to die who are expected to die. It may be that there's a cultural expectation that people will die in hospitals. It may be that there's a difference in the way that GPs want to manage their patients. But I think what's happened is that the government at the moment is hell-bent on denigrating and undermining the NHS, and these statistics are being taken by people and used for that end, when we should be using them for patients' benefit.
Do you accept that? I mean, this is not a point made in isolation. There are many people, doctors and patients among them, who have, they believe, a very real fear that that's exactly what's happening.
Well, one of the problems is patient safety gets taken over by party political debates. I was horrified to hear the way that both spokespeople in the House of Commons received and discussed the Keogh report into the 14 hospitals. This isn't about party politics. Frankly, both governments, this one and the last one, have a lot to answer in terms of failures in patient safety and unnecessary deaths in hospitals.
And how much do you feel it is our inability, all of us, because the NHS is so, it's a bit of a cliche, but it's so precious to everybody that we don't feel we can discuss it openly, and that is one of the difficulties.
This is one of the problems. My charity, which is the National Charity for Patient Safety and Justice, hears every single day about tragic loss of life, quite unnecessary, and lives being devastated by unsafe care. So there is absolutely no room for complacency, and we can't be too precious. We'd be the first people to celebrate all of the fantastic things that are done in our NHS, but there's a lot of work to be done to make it truly safe.
Very briefly, if you would, I mean, what do you think needs to happen to the debate to make the NHS better, to make it the service that we want and should get?
I think the patient should be put at the centre of this. I absolutely agree. I think we should recognise that the NHS sees, I think, 1 million people every 36 hours, and the vast majority of those have a very good experience. I think we should stop politicising it. The NHS is being subject to these huge upheavals. Something like 6,000 nurses have lost their jobs. We're trying to save £20 billion. You know, let's stop the politics and put the patient at the centre.
If I might say, the main thing is to get on and learn the lessons from Mid Staffordshire and implement the recommendations.
Thank you very much, both of you. Thanks for joining us.